The patient was a 65-year-old white female, well-dressed, well-mannered, good historian. Presents with chief complaint she's had a cold for 2 weeks, states not getting any better. States she's been having coughing fits day and night, not sleeping very well, coughing up a thick green-yellow sputum. States chest pressure right side times 3 days. States unable to get a good breath. States she's been taking Robitussin and Tylenol with no relief. Past medical history is hypertension and seasonal allergies. Takes HCTZ 25 milligrams PO daily. Denies any hospitalizations or surgeries. Social history is non-contributory. Family history, mother has a history of hypertension. Review of systems. Denies fevers, chills, sweats. Denies any lesions, rashes, breaks in skin. States she thinks she had a lump on the right side of her neck a couple days ago. Denies any head trauma, stiff neck, thyroid problems. Denies any difficulty seeing, double vision, or drainage from the eyes. States some nasal drainage over the past 2 weeks. Clear drainage, no blood. Denies sore throat, difficulty swallowing, or problems with her teeth. Respiratory, refer to the HPI. Heart hypertension, states well controlled with a 25 milligrams HCTZ daily. Denies any rapid heart rate or pounding. Denies nausea, vomiting, diarrhea. Denies any urinary burning, frequency, or urgency. She's complaining of right flank pain and right mid and lower back pain for 3 days. Denies any seizures, tremors, or dizziness. Denies any suicidal, homicidal. Denies any depression. Vital signs. She's 5'3", 147 pounds, blood pressure 138/92, temperature is 101.8, heart rate 70, respirations 26, and her PO was 93% on room air. She was alert and oriented times 4, well groomed, skin was hot and moist, no tenting, hair evenly distributed, symmetric, no lesions, no masses, bilateral eyes, pupil, equal round, reactive light, accommodates. Eyes past Snell and eye chart bilaterally with corrective lenses. Hearing past bilaterally 20 decibels. Crewman buildup bilateral ears. No tenderness to sinus palpation. Neck, trachea, midline. No masses or lymph nodes palpated. Thyroid not tender or enlarged. Lungs symmetrical. Chest expansion anterior posterior lateral ratio 2:1. No retractions. Rate slightly increased but non-labored. Upper lung fields resonate to percussion. Dull percussion elicited bilateral bases with scattered crackles. Bilateral lower lobes. Scattered bronchi throughout, right, middle, and lower lung fields, positive for egophony and bronchophony. Heart, S1, S2 heard, did not hear any additional heart sounds, no thrills, lifts, or bruits identified. Blood pressure was 138/92. After taking your 25 milligrams of hydrochlorothiazide this morning, 2+ pulses bilateral, radial, and brachial. Normal reactive bowel sounds, all quadrants. Activity percussion, all quadrants. Light palpation, all quadrants without guarding, distension, or masses. Deep palpation, all areas without pain or masses. Pain identified while percussing. Palpating the liver, spleen was unpalpable. General urinary was deferred. Musculoskeletal right anterior chest wall tenderness along the costochondral junction. CVA tenderness right lower back. Cranial nerves 2 through 12 intact. Diminished response to deep tendon reflexes, bilateral upper and lower extremities. Patient with pneumonia, probably bacterial, due to the increased platelet count, white blood cell count, and neutrophils. Differential diagnosis, possible PE, ruled out with a chest X-ray. Also ruled out tuberculosis and lung cancer. Influenza was a differential with viral. Bronchitis didn't show liver disease due to the palpation and the tenderness around the liver. Ruled out due to AST and ALT were within normal limits. Renal disease ruled out due to thought about because of CVA tenderness, however ruled out because the BUN and the creatinine were within normal limits. Previously healthy and has no antibiotic use in the last 90 days. Recommend azithromycin 500 milligrams PO on day 1, then 250 milligrams daily for the next 4 days. Recommend 650 milligrams acetaminophen and 600 milligrams ibuprofen rotated every 4 hours as needed for the pain. Patient can receive influenza vaccine during the outpatient treatment. Gold standard for this is obviously the chest X-ray, PA, and lateral views. Chest X-ray showed consolidation, right, middle, lower lobe, ruling out any masses, PEs, tuberculosis. ECG to rule out any possible MI. CURB 65 criteria: confusion, uremia, respiratory rate, low blood pressure, rate 65 years and greater. Pneumonia index to identify patients with pneumonia who may be candidates for outpatient treatment. Her CURB score was a 1, means that she was suitable for outpatient treatment. Blood tests include CBC and CMP. Results showed an elevated RBCs, elevated white count, decreased lymphocytes, elevated neutrophils, elevated chloride, and possible cause for the increase in red blood cells includes dehydration and hypoxia. Includes white blood cells indicating infection, increased neutrophils indicating it's bacterial. BUN, creatinine, AST, ALT, alkaline phosphate, bilirubin, albumin were all within normal range, ruling any kidney and liver disease. Education. Importance of taking all medications until completed. Get plenty of rest. Stay hydrated. 1 to 2 liters of fluid daily. Take several deep breaths every hour and cough for lung expansion to loosen up the mucus. Go to the emergency room if breathing becomes more labored. Symptoms worsen. You have worsening chest pain, any confusion, unable to keep your medicines or fluid down. Also explain the possibility of hospital admission if symptoms don't improve. Just explain the importance of pneumonia and influenza vaccines. Wash hands often, cover nose and mouth during coughing or sneezing exercises. Health maintenance, make sure that she's monitoring blood pressure daily. Her BMI is 26.4, so she's within normal limits there. According to Center Disease Control, 25 to 29% is considered overweight. Talk to her about her diet and exercise program, where she normally walks a mile a day, unable to do so due to the pneumonia infection right now. Recommend that she have one HCV test in her lifetime. Colon cancer screening should be done with colonoscopy every 10 years, with a fecal immunochemical test annually. Other recommendations by the CDC include influenza vaccines every year, Tdap every 10 years, zoster vaccine, and pneumococcal vaccine, which is 2 injections at least a year apart, and a mammography every 2 years. Further lab diagnostic studies of chest x-ray, PA, and lateral views in the next 30 days, also blood culture and sputum culture. Referral to a hospitalist if symptoms worsen and the patient becomes more hypoxic. Follow up in 10 to 14 days for re-examination, 30 days for the next chest x-ray. Hypertension. Patient's currently taking hydrochlorothiazide 25 milligrams PO every day. According to JNC8 guidelines, she's being managed okay. Her pressure is 130/92, is outside the acceptable parameter. The one under 90 for patients over 60 years old. We're going to maintain the current medication regimen until the infection has been treated and she resumes normal activity, monitoring just to make sure that see if it goes back down where it belongs. If not, we'll consider adding an ACE inhibitor to her medication list. Lifestyle modifications is diet and exercise, reduce sodium intake, and increase potassium consumption. Health maintenance, we want to make sure we're wearing sunblock, protect your skin from harmful rays, fasten your seatbelt, avoid driving or driving with others while under the influence of alcohol or drugs, practice safe sex, using condoms. Further lab diagnostic is a fasting lipid panel, urinalysis, and TSH. They were all within normal limits a year ago. BUN and creatinine are within normal limits. This helps resolve any renal dysfunction. Follow up 10 to 14 days for reevaluation and BP check. Further follow up based on our findings of those blood pressure checks. Seasonal allergy rhinitis, pharmacological interventions, 10 milligrams OTC Zyrtec PO as needed in the daytime, Flonase 1 to 2 puffs nasally as needed, 50 milligrams Benadryl PO at night as needed. Non-pharmacological interventions, allergen avoidance, nasal saline irrigation. Education antihistamines may make you drowsy. Do not drive or operate a machine while under this effect. Don't use nasal decongestants on a regular basis due to rebound effect of the congestion. Keep windows and doors closed, reduce allergens, and use HEPA filters at home to help minimize the pollen. You need to get your A1C checked every 3 years and bone density testing, and also get tested for depression. For the lab diagnostics allergy skin test, referral to an allergist. We'll follow up with the allergen skin test after the results.